Hello everybody, this is Adam, the geneticist from Verdure Healthcare. Welcome to my talk on chromosome 13 part 3, and this is related to eye cancers. Okay, and this part is quite scary, so just to give you a bit of a refresher, so the 13th chromosome is the 13th largest in the entire set of our human chromosomes. Okay, so we always hear about chromosome, DNA, and genes. So what are their relationships? Okay, just let me freshen your mind a little bit. Our body is made up of cells. And within the cell, there is the command center called the nucleus. Within that, the commanders of the cell are called chromosome. So pretty much the chromosomes control everything in the cell. But what exactly is a chromosome? They are packs of DNA. So imagine the string, just like this one I have here. If it's a loose string like this, it will be like the DNA pieces. But if you pack them together neatly like this, it will become the chromosome. Okay, so it looks neater and tidier in the body being packed into the cell. And that every living thing on this earth is made out of 4 codes of life. It's G, C, A, and T. All right, and just these 4 codes, they make everything living on the face of this earth. So it's pretty fascinating. All right, so there are 2 main types of genetic disorder. One is the single gene disorder. Okay, so how I would say this usually is that, for example, if you can use my illustration just now, the piece of DNA, imagine this wire is the DNA. So somewhere along this DNA, there is a broken piece, there is a mutated piece, and that is how it causes diseases. And we call it single gene disorder. But there are the bigger ones, okay, it's called the chromosomal abnormality. Now, a very typical example would be the Down syndrome, whereby there is an extra piece of chromosome in the chromosome 21 slot, 3 chromosomes instead of a pair. That's how Down syndrome happens. But there are other more complicated symptoms within this category. So as long as there's something happening in the piece of chromosome, remember chromosome is a pack of DNA, whereby if this piece, the big chunk, happens to be mutated, then there will be an even bigger problem. So there are 2 levels of genetic disorder. Okay, so remember that chromosome 13 is a major disease chromosome. A lot of diseases have been found related to chromosome 13. So mainly I picked out 6 of the most common ones, including autosomal recessive, neurosensory deafness, breast cancer, Patau syndrome, and today we're going to talk about retinoblastoma, Wilson's disease, and young Maddis syndrome. Okay, so if you haven't gone through these diseases before, please look back into part 2 and part 1. So today we are going to focus on retinoblastoma, which is the eye cancer, Wilson's disease, which is a liver problem, and young Maddis syndrome, and this is a very rare and also a very severe kind of disease. Okay, so eye cancers, and particularly retinoblastoma. When you hear the word toma, this is the word for tumors, okay? So where is the retina? Okay, have a look at this. This is the cross-section of an eye. So this is the lens, okay, and this is the retina part, okay? So the inner part, whereby there are a lot of senses, okay? So retinoblastoma means that there is a piece of tumor within this backlining of the eye. Okay, and if that's the case, since retina contains millions of light-sensitive cells, they are called rods and cones, okay? So it receives visual information, it transmits the signal to your brain so that you can see the things in front of you. All right. So here it is, okay? You see here, that's the cancerous cell. It can, of course, happen anywhere along this line, but as you can see in this poor kid over here, this eye is normal. But on his left eye, as you can see that there is a very big white spot covering almost the whole of the pupil, Okay, so this is the retinoblastoma, and it is definitely one of the things that you really don't want because it's a very difficult disease to treat. Okay? Right. Now, let's move on to a whole different disease, Wilson's disease. Okay, so I'm not sure how many of you have heard of Wilson's disease, but it is a direct problem related to the liver. Okay, so this is the Wilson's disease liver, if you can see that. Okay, so it's a very rare inherited disorder, and that will cause the copper, which is a very harmful toxic material, and that has to be excreted out of the body. So when copper accumulates in the liver, what happens is that the brain and other vital organs, they will be affected as well. Okay? So most people with Wilson's disease, they are diagnosed between the age of 5 and 35, but it can affect even younger people as well, okay? Meaning below 5 years old. That's right. So Wilson's disease is progressive, okay? So what does it mean? Progressive means that the symptoms of this disease is going to get more serious as time goes. And if left untreated, it will cause, what's going to cause? Hepatitic disease, central nervous system dysfunction, and because of that, it might even cause death. All right? So I've researched a chart over here so that you can actually remember this disease a bit more clearly. So it's going to affect the central nervous system. It's going to affect the liver, of course, and it's going to affect the bones. It's going to affect the renal area. Okay, cardiomyopathy, meaning to say that there's something wrong with the heart muscle, and of course, there will be a ring around the eye as well. Okay. All right, so this Wilson's disease is actually caused by the ATP7B gene. Okay, so there is a defect in this gene, and it is inherited in an autosomal recessive manner. So what does it mean, autosomal recessive? Whereby mom and dad has to carry one piece of this, the disease in their gene, so that when they pass it down, okay, to their offsprings, one of them might be getting the disease. And how does this work? Okay, so remember that every human has 23 pairs of chromosomes. So now in this topic, when we focus on the 13th pair, so here I've drawn it out. Okay, so imagine daddy's chromosome 13, one of which has this Wilson's disease. But the other 13 chromosome is okay, it's fine. And same goes for mom, all right? What happens if the dad passes on his Wilson's disease chromosome 13 and mom is also passing on her chromosome 13 diseased gene? It's going to let the baby have Wilson's disease, all right? So that's how bad things happen. But what if dad passes on the problematic chromosome 13, but mom passes on the healthy chromosome 13? The baby will become a carrier, okay? And vice versa, if let's say mom passes on the Wilson's disease chromosome 13 for the baby, and dad is passing on the healthy chromosome 13, then the baby will become the carrier. And even though that the baby is a carrier, he or she is not going to be affected by Wilson's disease. But of course, the more idealistic scenario is that if, let's say, father and mother passes on the healthy chromosome 13 without the defect in ATP7B gene, then obviously that will be the best situation. Okay? Right. So I hope the previous two diseases is not very difficult to understand, but young Maddis syndrome is a little bit more complicated. Okay, so sometimes it's known as the pseudo-trisomy 13 syndrome. All right, and so this is a disorder resulting from the defected and duplicated chromosome 13. Okay, which can result in the forebrain of the embryo failing to develop. Okay, it means that the whole forebrain, there is no bone, something like that can happen. Okay, fails to develop into two hemispheres as well. So polydactyly is a supernumeracy finger and or toe, meaning to say that they have an extra finger or toe. Facial malformations, well, this is more related to maybe their lack of bones or just typically the whole malformation. And of course, serious mental retardation. Now, I must emphasize that this is an extremely serious syndrome, okay? And so there isn't many cases seen before, but honestly, it hasn't seen anybody living past 5 years old with this particular syndrome. So what is pseudo-trisomy 13? Okay, if you have listened to my previous part 2 video, there's something called the Patau syndrome. Patau syndrome means that on the 13th pair of chromosomes, there is an extra piece. So what is this young matter syndrome and how is it different compared to Patau syndrome? Now, if you have a full-on extra piece of chromosome 13, that is called Patau syndrome. But if you have only bits of the chromosome 13, okay, imagine this is half of the one of the chromosome 13, okay, over here, duplicated over here, then this is the young matter syndrome. Okay, so in terms of the symptom, is it really that much of a difference? Not really. Okay, so often young matter syndrome will be confused with Patau syndrome. So it's just only one line of a difference. Okay, so majority of the symptoms, including hypoplasia, cleft lips, cardiac lesions, and other heart defects as well, along with everything that I have mentioned in the previous slide. Okay, so in summary, I must say that young matter syndrome is actually incurable, at least for now, because majority of the babies, they won't make it past birth. Okay, so with all other diseases such as Wilson's disease, retinoblastoma, how do you cure it? Okay, honestly, at this particular moment, we don't really have a complete cure. But in theory, what we can do is, if we want to replace the mutated gene, what we can do is a gene therapy. Meaning that we can actually alter the gene either outside of the body via synthetic means. We inject this medicine into the body and hopefully that will change the entire gene. Or what we can do is we can take out some of the cells from the body. We do some genetic engineering on that, and then after genetic engineering, we put it back into the body. This is called ex vivo genetic therapy. Now, whatever kind of gene therapy it is still more like a science fiction than a reality. So it's still quite a long way to go. Okay, so since gene produces protein, what we can do is, at the protein level, do some replacement and therapy. Sometimes it's called protein replacement therapy, and it has been successful in some cases of hemophilia A, which is a kind of blood disorder. And then sometimes we can use enzyme, okay? Enzyme replacement therapy for some of the genetic disease as well. But all of these are only temporary. So if it's metabolic dysfunction, all right, because we all humans and all living things on this earth will metabolize, and if it is a related genetic disease causing metabolic dysfunction, what we can do is to use disease-specific compensation, such as diet modification, and more serious ones, we can use pharmacological agents that can actually replace some of the inborn errors of metabolism. And if, for example, there are some genetic diseases which totally affects the entire organs, such as the Wilson's disease, cystic fibrosis, and even retinoblastoma, what we can do potentially is to use organ transplantation. But of course, that is another difficulty. Anyhow, this is a surgical intervention in order to replace the entire organ being troubled by genetic mutations. But of course, since there are all these, treatments, why not we just try to prevent this? There is a method of doing that. It's called genetic counseling and genetic testing. So at Verdure Healthcare, we have something called the pre-pregnancy DNA screening. Some of you might have heard of pre-marriage health screening, but that is more of a general screening, blood test and hormone test, but we are going deep down to DNA level. Okay, so why do we bother to do these pre-pregnancy DNA screening? Okay, so as I mentioned before, if let's say the parents are carrying a copy of the disease gene, and if coincidentally both parents are carrying the same disease gene, when that gets passed on to the next generation, it's going to be very fatal. So back in 2015, the University of Chicago, their School of Medicine, made this article. Humans carry 1 to 2 lethal recessive mutations on average. And so what happens if we do that? Humans carry on average 1 to 2 mutations that, if inherited from both parents, can cause severe genetic disorder or death before reaching reproductive age, report scientists from University of Chicago and Columbia University. So both of these universities are some of the top ones, top medical schools in the United States. They have joined hands together and made this research. So we pretty much cannot argue with science, whereby we must admit that nobody is perfect. We all will carry some sort of mutations in our body. So it's just a matter of if we are carrying the same genetic disease. Okay, let's come back to Malaysia. Yearly, around 16,500 of Malaysia's 550,000 babies are afflicted with congenital abnormalities, and about 1/3 may succumb to these illnesses before reaching their first birthday. So pretty much what University Malaya Specialist Center is saying is that, okay, we have got this many babies being born every year, okay, 550,000. But about 16,500 of them are suffering from inborn errors, or just to be straightforward, genetic diseases, okay, or birth defects. So that is about, okay, 1 in 30 babies in Malaysia, okay. This is a rather high number, and we can actually do something to stop these diseases from happening. There are 2 methods which I will share with you. So at Verdure Healthcare, our pre-pregnancy DNA screening, it has 2 levels, okay? So it has 2 levels packaged in one screening package, whereby, first of all, we will screen for all 23 chromosomes in your body. And I will show you a sample report. Okay, so this is the report from one of the husbands. As you can see, that he has got complete 23 chromosomes, whereby 1 piece of X chromosome and a Y chromosome, which is the male chromosome. And for his wife, as you can see that there are 2 X chromosomes. Okay, so what can we do? What does it even say? Okay, so looking at all these chromosomes, so what we do is for every piece of chromosome, we are going to look out for 5 kinds of abnormalities. Deletion, meaning that there is something missing from this piece of chromosome. Duplication, meaning to say that one part has been duplicated, has been photocopied twice or once, and that shouldn't be there. And inversion means that, okay, there is no added or deleted information, but for example, if this is point A, this is point B, it is flipped around. Okay, so pretty much there is a joke from one of my professors, okay, whereby what happens is that you're eating the dessert first, then you eat the appetizer, only then you eat the main course. So the order is not right, okay? So inversion is exactly this happening. A substitution is whereby, for example, chromosome 4 and chromosome 20, something from chromosome 4 has gone to chromosome 20. Okay, so this is a one-way gift whereby I'm giving you a present, but I'm expecting nothing in return. So this is substitution. Okay, but this is only an example. It can happen between any 2 chromosomes. For example, chromosome 1 and chromosome 22. chromosome 7 and chromosome 13, it can happen. Whereby a translocation, all right, is a two-way swap, okay? Whereby I'm giving you a present and you give me something in return, okay? Just like swapping presents during Christmas. Whereby it's the same example applies, chromosome 4 and chromosome 20, whereby something from chromosome 4, okay, this blue part over here, has gone to chromosome 20, and then chromosome 20 has come to chromosome 4, okay? So there is this swap around. Now, there is something really that we have to look out for within translocation, whereby specifically between chromosome 9 and chromosome 20. Chromosome 9 and chromosome 22. So if let's say chromosome 9 and chromosome 22 has swapped around, okay, with just not the whole thing, but the pieces of it, it will cause something called the Philadelphia chromosome, and this will cause blood cancers. Okay, so that is why, despite all these confusing chromosomes, whereby normally, a layman would ask us, well, Adam, what can you even tell from this? Okay, we will tell them these are the things that we are looking out for. There is a client whereby something from chromosome 6 has gone to chromosome 10, and something from chromosome 10 has gone to chromosome 6, which is the translocation, and that caused 7 miscarriages. Okay, so that was part 1, okay? All right, and now we're moving on to part 2. So as you can see that part 2 is not really that simple. I'm not going to go into details, but this is actually a picture of what we call the next generation sequencing. Okay, if you can recall that earlier in this video, in fact at the very beginning, I've mentioned to you that there are 2 levels of genetic disease. One is what we mentioned just now at the chromosome level, and now we are going to focus on the bits of DNA. So one more time, I'm going to use this illustration, Mawaya, whereby just now we are looking at the chromosome, this piece. Now we're going to zoom in on this chromosome, and we are going to look at the pieces of DNA and see if there are mutations. So at Verdure Healthcare and our pre-pregnancy DNA screening, we can screen for 500 of Asia's most common genetic diseases. Yet, each of these diseases has their own version. So for example, alpha thalassemia, I'm sure many people have heard of this disease. There are already over 100 variants within alpha thalassemia. So that is why you see that sometimes people, they get a more serious symptom despite 2 persons have the same disease. One might be getting the symptoms earlier, and the other one might be getting the symptoms in a bit later in his life. All right. So altogether across all 500 diseases, there are over 370,000 variants. That's a lot, and we're going to screen each of them for you. Okay, so let me show you a sample report. This is from the husband, whereby he is carrying 1, 2, 3, 4, 5, 6, 7, 8, 9 diseases. Okay, so 9 diseases, and still, if that wasn't enough, we have found over 51 unknown variants in his DNA. Okay, meaning that these are actually mutations. Variants means that these are mutations, but so far, because these mutations are so rare, there is no scientific evidence to suggest that, okay, this part over here is going to cause some disease, all right? So anyhow, we have found 51 of them. As for his wife, we can see 1, 2, 3, 4 genetic mutations, okay? And they are directly related to some of the diseases. We have also found an extra 41 variations in her other genes. Okay, since there are so many mutations, is there a matching pair? Yes, there is. Fortunately, only one, and it's not exactly a very serious disease. So that's how we help people. We see that, okay, this over here, the name is a bit long, bear with me. It's called the adrenal hyperplasia, congenital hyperandrogenism, non-classic type due to 21-hydroxylase deficiency. So with this report, what we can see is the name of this gene. In this case, the gene that's going to cause this disease is CYP21A2. So we know the name of this disease. And we also know the effects of this disease. Is it really going to cause a disease, or is it just like a benign tumor? In this case, it is likely pathogenic, meaning that there is scientific evidence to suggest that somebody in the world has got this variant of the disease and it has really made the symptoms to come out. Okay? Genetic variant, we know the versions already. We know the location of this disease causing gene, which is on chromosome 6. And this is the area to find it. Okay, so it's like the address of the gene. The transcript meaning to say that, okay, if let's say this particular gene is really happening in their offspring, okay, so their offspring, touch wood, has been affected with this genetic disease, what is it going to look like? What are the symptoms going to look like? And of course, according to that, we see the genomic change. Okay, so with all of these information, we will be able to send this couple to an IVF center and specifically ask the embryologist to look out for these information I showed you just now, so that they can do a very precise selection on the embryo. So for example, if this couple has got 10 embryos, and whereby we will screen them for all of them, okay? And by the way, it's called the PGS-PGD, pre-implantation genetics screening, or pre-implantation genetic diagnosis, whereby we will screen for all the embryos. We will look out for the mutations that I mentioned just now, and of course, we'll also look out for any other unrelated mutations too. Okay, so coming back, what is adrenal hyperplasia? Adrenal is the gland above the kidney, and this is a very heavy base for producing body hormones. Okay, so for example, adrenaline, cortisol, prolactin, and pretty much all of the important hormones in the body are produced via this adrenal gland. So if there's a mutation in the adrenal gland, your body will suffer. Okay? But there is one more problem. Okay, in the husband, we have found something called familial dilated cardiomyopathy. So what is this? Okay, anyhow, we know that the gene is called TTN. It is going to cause harm. We know the variation, we know the location, it is at chromosome number 2, and then we know the effects, and then we know the genomic changes that cause the effect. So, but friends, as you can see over here, there are two columns, okay, two rows, sorry. So, it means that this particular disease has been generated by two mutations in the same gene, okay? Right. So in that case, what we can say that this disease has been double powered. And if that's the case, it is really a serious situation. So what is familial dilated cardiomyopathy? It means that a normal heart, which looks like this, whereby somebody with this disease, the muscle of the heart is called the cardiac muscle, has thinned down, okay? Meaning to say that you have to use extra energy in order to pump the same amount of blood around your body. Can you imagine walking with only 50% of the muscles? I bet you can't. I bet you can't even stand up. So same goes for the heart. If it has to use extra power, it really means that the life of this heart has been halved. Okay, so this husband, okay, because he brings along with his wife to come and see us for infertility, but when I organize this test for them, I can see that this is an immediate problem. So I referred him to a cardiologist, whereby we got him patched up immediately. Okay, so even though that there is no fixed solution or a one-size-fits-all solution, but what we can do is to monitor his body almost every semi-annually. I planned out a diet plan for him so that he can avoid disease-causing foods, oily foods, something like that. And of course, there are other medicinal treatment by the doctor as well. Okay? But here's the most serious and most headache-causing point. Just now we talked about parents need to have two copies of the disease-causing gene in order to be affected himself. And that is called the autosomal recessive disease. But now this is autosomal dominant. So what does that mean? It means that you only need one copy of this disease gene, and it is already enough to cause you that disease. Okay, you don't have to have a pair, you only need to have one. So that is why, despite his wife doesn't have familial dilated cardiomyopathy, the husband himself, when he passes on this gene to his next generation, it will be enough to cause the disease in their offspring. So all in all, it means that if they were to get pregnant naturally, there is a 50% chance of their kids getting familial dilated cardiomyopathy. So two problems, adrenal hyperplasia and familial dilated cardiomyopathy. All that has been found with our Verdure Healthcare pre-pregnancy DNA screening. And we are very proud of this case because the husband was already 46 years old by the time he came to us. And then pretty much I can say that this genetic screening actually helped to save a human life. Okay, so who's going to literally do all this testing? So the lab is called Genomics Lab. So it's based in Kota Damansara in Selangor. And they are the only lab that has been credited by the College of American Pathologists. And it is a very strict organization. Okay, so with that, okay, they are the ones who's doing the scientific testing, they are running all this complicated sequencing. So when the report comes in, who is going to explain that to you? I will. I will personally explain the report to you and also tell you what is the next solution. Of course, majority of you will come here for fertility treatment and also to boost up your fertility health so that there's a higher chance of you having a healthy baby. But I will use this test as well to see if you are having any potential problems that needs to be fixed immediately. So at Verdure Healthcare, we don't just have this test, we have cancer testing as well, we have cardiac gene testing, heart disease gene testing, meaning so we are able to help you if you are having this problem in your family. So for example, if majority of your family members had gone through cancers, then you might be worrying about this area and we are able to help you out. But anyhow, by regulation, I must introduce myself to you as a geneticist. Okay, so what does a geneticist have to have in terms of qualification? Okay, my background is a postgraduate certificate in surgery from the Royal College of Surgeons of England. So I'm an instructor, but I'm no longer teaching surgery. Instead, what I do is I focus on genetics. And I'm certified by Stanford University with their Stanford Genetics and Genomics Certificate. But anyhow, since we are following the United States, we have to follow them to the end. And what their regulation is saying that, okay, even though if you are a geneticist, you can pretty much be doing something totally unrelated to medicine, okay? And because of that, we have to further study. Okay, so I'm certified by Harvard Medical School specifically in genetic testing and sequencing technologies. And I'm also certified by the second best medical school in the United States, Johns Hopkins University, with genomic data science. All right, so all of those complicated data that you saw just now about genetic location and stuff, it's all about genomic data science. Okay, so just one more concept I want to bring to you is the commercial DNA tests, such as Circle DNA, and I do see that they have advertisement, previously on YouTube. So what happens is that you order a kit from the relevant company, okay? They will send you a package, something like this. All you need to do is to collect your saliva sample, put it into the tube and send it back to them. So it's pretty much quite similar to COVID-19 antigen testing. But this sort of genetic test can only be used for wellness and health keeping. Okay, so because they will be telling you what kind of sports you should do, if you need to eat any specific kind of food in order to thin down, something like that. So it's pretty much a general health kind of genetic testing, right? So it's nothing wrong you do that testing, but they are not clinical, because clinical genetic testing, like our Verdure Healthcare pre-pregnancy DNA screening, infertility genetic screening, cancer gene testing, they are all clinical. Why? Because there is a follow-up solution that is needed for you to be healthy, okay? For you to have a medical solution, okay? So in that case, the report accuracy is 99.99% accurate, okay? So after the testing, whether you have mutation or not, it really doesn't matter at this stage, okay? At this stage. Why? Because no matter if you are going to get pregnant by natural means or with IVF, what you really need to do is to enhance the quality of your sperms and egg cells. Okay, particularly if you need to go for IVF due to having the same genetic mutations. And with that, okay, Verdure Healthcare, we have won the 2022 Baby Talk Mama Papa Reader's Choice Award, and we have won the Fertility Center Bracket Kuala Lumpur of the Year Gold Award. And also we have won the NIPT and Genetic Counseling Service Gold Award in 2022. It's all the Reader's Choice. So I would like to take this opportunity to really thank all of our great supporters, all of our gracious clients giving us this chance. If not, we are never going to be able to have this achievement. So really thank you. And furthermore, and even better news is that, okay, as you might know already, in 2021, we have won the Super Brand Award. But now in 2022, we managed to maintain it. Okay, so this is a screenshot that I took from their Super Brand Malaysia official Facebook webpage where they made the announcement. So we have maintained Super Brand all the way from 2021 to now, okay, 2 years consecutively. So please keep your fingers crossed for us. In 2023, we are able to maintain that as well. We strive to provide you the most advanced genetic services and also the best fertility service. Okay, so enhancing the sperm cells and the egg cells, afterwards in step 3, now we are going to talk about conception, the way to get pregnant. So basically there are 2 ways, the natural way and also the IVF way, or the assisted reproductive technology. So whereby if, for example, you don't have any mutations, okay, whereby you and your spouse are all clear of any genetic mutations, in that case, we have something to recommend you. It's called the home artificial insemination IUI. Okay, so majority of our clients, they are worried, they are stressed about making their significant other pregnant. Okay, so especially for husbands. So a lot of clients have complained to me that, Adam, I just cannot perform well during the correct time of the month to make my wife pregnant. So in that case, we have this in order to help the husband. All this couple have to do is to use 3 steps, okay? Mainly the first step is to track the menstrual cycle. We need to understand when will the wife be ovulating. So once we get the hang of that, okay, during this time of the month, as you can see, there's temperature bump. That's what happens when the lady's ovulating. Okay, so over here, during the time, we can use something called the LH, luteinizing hormone test, to confirm whether the wife is ovulating. If it is, then what we can do is to use the artificial insemination IUI kit in order to transport the sperm cells directly into the uterus. So it means that there is a shortcut for the sperm cells. So it is very easy to assemble, yeah? Okay, whereby all you need to do is to connect the hose, whereby there's a syringe to collect the sperm cells. Okay, through the tube over here, it connects to a blue component. Okay, the blue, it's a tube whereby what happens is that this tube will transport the sperm cells directly into the uterus. All you need to do is just to push the syringe. Okay, so it's pretty much just like an injection, except this is totally medical safe. Okay, so who is suitable? Okay, for males with either low sperm count, poor motility, meaning the sperm cells swimming capability is poor, or some abnormal shape. But of course, we would strongly advise you to enhance your sperm cells first before using the home-assisted reproductive program. Okay, because it is extremely effective. A lot of our clients, when they bought it in September, a lot of them were pregnant in October. Okay, so females with high amounts of antibodies, suffering from recurrent genital infections, pain during the intercourse, so all of these problems can be overcome with our home IUI kit. Okay, but if you really do have a genetic mutation, then how shall we go about this? Then we have to go with IVF. And within IVF, we have to go with the pre-implantation genetic screening, whereby when the doctors collect the egg cells, on the same day, the husband will need to produce a sample sperm cells. When that gets connected together in the lab, it's going to form the embryo. And before this embryo gets put back into the body, into the womb, we can go through the genetic testing. But one problem, this genetic test is not cheap because this test is done on the embryo, whereby we have to poke a needle into the embryo and take out some of the cells. This is a very complicated technology, and that's why nowadays the hospitals are charging around 35 to 50,000 a cycle for this PGS-PGD. Okay, and at Verdure Healthcare, we work with many partners. So for example, Alpha Fertility Center, TMC Fertility, Sunway, Thompson, okay, these are our main partners, okay, not the only partner, but the main partners. We work with BP and Path Lab nationally. We work with two of the most advanced labs, genetic testing labs in the world, Genomics Lab and DNA Lab. We work with Sonovision and we work with Gribbles as well. So all these partnership and medical network will help you have a healthy and cute, adorable baby. Okay, so just one last take from this talk over here. I want you to remember this. Your genes determine your baby's lifetime health. There is a lot you can do about it right now before you literally get pregnant. Some of the doctors advise the couple to go for the test similar to our pre-pregnancy DNA screening only when they are pregnant, but by the time it will be too late. Okay, so why not we take everything early in our hands, we test for any diseases in the body, and we deal with it earlier, okay? So that we don't let any of those genetic mutations to be passed on to our next generation. Okay, so that comes to the conclusion of our talk for today. So if you are planning to conceive, please do give us a call. We would love to hear from you. And this video will be put on YouTube as well, so kindly subscribe to our channel so that you get the latest fertility education from me and also from Dr. Terence, where she's also doing Facebook Lives. So I hope you can share this video to the friends and family in need, and we will really appreciate if you can give us a like on our video. Thank you very much, and I'll see you next time.